This is another presentation by My Weight World.
Weight and nutrition before, during, and after pregnancy, keeping your body and baby healthy and well fed. This presentation should only be used as background information. We suggest that you always discuss any concerns with your doctor. This presentation will focus on strategies for weight management and optimal nutrition for women who are planning a pregnancy, may be pregnant, or recently have had a baby. This is an especially important time to focus on selecting the right foods and balancing out your calorie intake with your actual needs. This presentation will give you information you need to make healthy food choices before, during, and after pregnancy, and help you establish habits for healthful weight management after the baby arrives and beyond. The best time to start eating for two is before you are even pregnant. Focusing on healthy food choices, regular exercise habits, and normalizing weight can help optimize your chances for conception as well as the well-being of you and your baby. Taking a prenatal supplement or at least a daily multivitamin with iron and folic acid can ensure you have these important nutrients available right from the start when they can really make a difference. Remember, many women do not even realize they are expecting until around the 6th week after conception. Even though you might be taking a supplement, it is also important to get folic acid from foods. These food sources include grains such as pasta, breads, cereals, and rice, beans, peas, and colorful fruits and vegetables, especially citrus fruits such as oranges and orange juice. Folic acid is especially important in the early stages of pregnancy, helps reduce the risk of birth defects affecting the nervous system and spinal cord. An adequate intake of iron in pregnancy helps maintain production of red blood cells and distribution of oxygen throughout the body. This is especially important during pregnancy when blood volume significantly expands. The daily recommended intake during pregnancy is 27 milligrams. Besides iron-rich sources of food such as eggs, red meats, dark meat of poultry, enriched cereals, and other foods, your doctor might want you to also take a supplement if your blood iron levels are low. Other nutrients especially vital during pregnancy include zinc, found in meats, nuts, beans, poultry, whole grains. This helps maintain healthy metabolism, including blood sugar control, cell division, and proper tissue growth. The daily recommended intake during pregnancy is 11 milligrams. As you might notice, many of these nutrients mentioned are found in many of the same healthful foods. When it comes to building strong bones for the baby and maintaining health and strength of your own, calcium, vitamin D, and other minerals are vital. Not only do they build and protect the skeletal tissue, calcium-rich foods also provide energy, protein, and also are involved with heart and muscle contraction. Dairy products such as yogurt, milk, and cheeses are terrific sources, but these nutrients can also come from soy products, fortified foods, and supplements if needed. For a quick energy boost, a cup of milk has a great combination of protein, carbohydrate, and fat, along with the bone-building nutrients mentioned, and does a great job satisfying the appetite between meals or snacks. It may seem that with all of this extra nutrition required, you will need to eat at least for two. However, your calorie needs during pregnancy are not actually that much higher than usual, actually amounting to about 1/6 more than your usual needs. Excess weight coming from excess calorie intake before and during pregnancy can increase risks for several health problems, including diabetes in pregnancy or gestational diabetes, high blood pressure, longer labor and delivery, cesarean section delivery, and even higher risk of weight problems in the offspring of overweight women. So to prepare for a pregnancy as well as to optimize your health, start with a healthy meal plan recommended by your doctor or registered dietitian. What works best for most people is a regular food intake of 3 meals per day and some small nutritious snacks as needed. Skipping meals or freestyle eating is usually a major reason for inadequate nutrient intake and weight problems. Daily activity to increase your metabolism, the rate at which you burn calories, and build up muscle strength is essential for weight control and a healthy diet. In a healthful diet for an anticipated pregnancy, there is little room for empty calories. A cookie now and then isn't harmful, but a big bag of chips and a soda as a regular snack pushes more nutrient-rich foods out of the way, which probably also have less calories too. Alcoholic beverages should be minimized and preferably eliminated pre-pregnancy and most definitely avoided during pregnancy because of the strong connection to birth defects. It is also wise to minimize caffeine, which can decrease fertility. While planning for a pregnancy, you might want to start slowly decreasing caffeine intake to minimize withdrawal symptoms such as headache and fatigue. To review, calorie needs during pregnancy are actually only 100 to 300 extra calories above your actual needs each day. This changes as pregnancy progresses. As the baby grows bigger and is more demanding on your body for nutrients, you will need to fuel yourself more. The first 3 months, when the size of the baby is very tiny and most experiences with morning sickness occurs, the extra calories needed are equal to about 1 cup of non-fat milk, about 100 extra calories per day. Like with a diet for pre-pregnancy planning, you want to make just about every calorie you eat a nutritious one. If you are very active and/or carrying twins or more, you will have a higher calorie need. This is an especially good reason to meet with a dietitian for meal planning, since as pregnancy progresses and your stomach gets smaller, it is more difficult to fit in adequate amounts of nutritious foods. Remember, calories are the energy that we get from protein, carbohydrates, and fats in our diet. Vitamins or minerals do not provide calories, and it is just as important to eat enough as it is to avoid overeating. To know if you are eating the right amounts of food during pregnancy, your weight gain pattern will be monitored by your doctor at each visit. Even with the recommended weight gain pattern as shown, there are certainly variations in this from week to week depending on several factors. Weight gain patterns during pregnancy may vary because of early pregnancy nausea and vomiting, which often is resolved by the 12th week. Appetite variations from day to day, less room in your stomach because of the baby's growth, and other factors. However, if you have concerns about the rate of weight gain, whether it is too much at once or not enough, be sure to check with your doctor. To summarize, the variety and amounts of foods that should be consumed daily for a healthful diet during pregnancy, foods providing protein, calcium, fiber, and the array of other vitamins and minerals should be consumed daily in the listed amounts. Small variations from day to day are not a problem, but a consistent pattern of food intake helps make it happen. Along with the previously listed nutrients, special attention on fats, fluids, and sweets should be noted. Healthful fats include nuts, olive oil, avocados, and those from fatty fish, such as salmon. Fats from fried foods, stick margarine, pastries, and snack foods are not only full of excessive calories, but harmful for your heart. Adequate hydration from fluids is essential because of increased blood volume and easy overheating. Water is the fluid of choice, with milk being another nutrient-packed fluid. 100% juice can also meet your fluid needs, but is a rich source of calories that might add up to excess weight gain, so limiting to 2 cups per day or less is a good idea. Minimize those liquid candy bars, sugar-packed sodas that are full of sugar and other useless ingredients. And be sure to follow your doctor's advice about a prenatal supplement, which is a safety net to ensure your needs are being met when food intake may be variable. A review of serving sizes can help you visualize how much of each food group to eat. For protein foods, think about a deck of cards. Grain foods can be related to one serving as a slice of bread or a half cup of rice, noodles, or potato. Fruit and vegetable servings can be related to the size of a tennis ball or your closed fist. One dairy serving is equal to a cup of milk or one slice of cheese or one string cheese serving. And a fat serving, which includes butter, margarine, or oil, is about the size of the tip of your thumb. To help you see how to put all these recommendations together, a sample menu is provided here that you can use as a guideline. Of course, your schedule, food preferences, and other factors may vary your choices. Since fitting in all the needed nutrients can be difficult with only 3 meals per day, small and nutritious snacks help fill in the gaps. Easy snacks such as string cheese, yogurt, and hard-boiled eggs with fruit fit a lot of nutrition into a small package. Remember, this sample menu is just a guideline. Conditions such as gestational diabetes need to be treated with specific dietary changes for blood sugar control, and advice from your physician, dietitian, and other healthcare providers will be required. After delivering a baby, most women are anxious to lose the pregnancy weight and get back into shape. However, it takes your body several months for hormones to normalize and for your body to recuperate after a pregnancy. Make sure to get approval from your doctor before starting an exercise and weight loss program. If you are nursing, you will still need extra calories and nutrients to maintain your health and milk production. Breastfeeding your baby, especially for at least 6 months, can help with using up fat stored during pregnancy, as well as providing both you and the baby numerous health benefits. Since breastfeeding can be challenging for many women, take a class, consult with a lactation consultant, or read books about breastfeeding. Continue taking your prenatal supplement, as well as healthy eating and daily physical activity for best results. Remember, plenty of fluids are essential for your hydration and milk production during breastfeeding. In summary, healthful eating before, during, and after pregnancy is beneficial to you, your baby, as well as other members of your family. Good nutrition is essential to help decrease risks of birth defects and complications in pregnancy. These healthy eating habits will also promote lifelong health and weight management no matter what stage of life you are in.
This has been another presentation by My Weight World.